Joining us now live is the former Health Minister, Greg Hunt, in Victoria. Thanks for joining us, Greg. First up, congratulations on that recommendation. It's so clear, it's so obvious, it's so much in the public interest. What did you do when you were the National Health Minister in the National Cabinet to try and force the states to do that?
Well, two things. Firstly, we published all of our medical advice from this, what was known as the AHPPC, or the collection of Chief Health and Medical Officers, and that was all published, and I've included that material as one of the annexures in the 1,700 pages that I've provided to the inquiry. The second thing is, stepping back for a moment, how did Australia do? The world went backwards with a loss of 1.6 years of average life expectancy over 2020 and 2021. The US went back by 2 years. Average life expectancy dropped. Australia was one of a very small number of countries that actually went up by 0.2 years. So the first thing is Australia, Australians, our health officials, our doctors, our nurses, whether they were federal, state, whatever, private, public, did a brilliant job.
I want to come back to that overall performance. But first of all, as you're talking about this advice, for instance, we had clear examples, and I think one of the clearest was school closures. The national medical advice, including from the Chief Medical Officer you would have worked closely with, including directly from the Prime Minister, including from many experts we interviewed on this program over that period, was that kids should stay at school. Yet you had, in Victoria especially and elsewhere in the country, schools being closed, and that's caused enormous damage. It must have been so frustrating for you seeing state governments do that when you knew the advice said otherwise.
Well, we, at the time, none of this is different from what we said at the time. At the time, we urged everybody to follow the national protocols. We recognised that you couldn't bind the states under the Constitution, and nor am I proposing something which would take away their powers, because they simply wouldn't accept it. You'd need a referendum, and that would never be successful. So what we said then about following the medical advice and what we say now is exactly the same thing. But given that the federal government has called a commission of inquiry and they invited me, they asked if I would participate, I felt it was my duty to do that. And my core recommendations are, firstly, that there should be a national code, and if we ever face a situation of a true national health emergency again, which unfortunately the chances are that over the course of the next 50 years that's likely to occur again in some way, shape or form. Secondly, we have that national code, and that where there are two things that occur, either restrictions or deviations from the National Cabinet decision, then there should be medical reasons that are written and signed at no lesser level than either the Chief Health Officer or the Deputy Chief Health Officer of a state or territory. And if the Commonwealth is doing that, exactly the same thing.
Yep.
And so I'm not looking for a lesser standard for the Commonwealth.
Nope.
We published our reasons for any biosecurity measures, and that should be the same, but we actually didn't have to. I think there's a gap in the Act because I could give instructions verbally, but we said that wasn't the right way to do it. We would publish all our AHPPC advice and provide reasons publicly.
That makes perfect sense. I'm glad you've set it out. It's a great recommendation to go to the federal government. But just backtracking then, for instance, when it came to school closures, even though you're the federal health minister, and we know the federal advice, the medical advice was to keep schools open, were you ever shown by any of the states contrary medical advice that justified closing schools?
Look, on schools, there were some differing views that were presented by the state.
But was there different medical advice?
From the Chief Medical Officer, from the advisory groups, was that there was limited spread amongst children. Historically, with lots of other forms of viral diseases, children are what's known as a vector. In this case, as the evidence emerged, it became less so. And so we encouraged schools to be kept open. And the medical advice that we had is that there was a strong case for that. Now, I see a picture of Gladys Berejiklian. She went out of her way to try to keep schools open and functioning, and others did as well. There were some states where that was not the case.
But did the states show you any medical advice to justify their decisions?
Look, they published some. Whether there was any individual medical advice that was, different to the approaches of the AHPPC, different to the material and provisions of advice that the Commonwealth officers provided, you would have to check with them. But our view was that schools were overwhelmingly a safe and desirable place. This is not new now. This is what we said in real time at that time.
Well, there needs to be a very thorough examination of all this. I think what the federal government's doing is substandard. There should be a full royal commission, but I suppose it's better than nothing. And your recommendations are very welcome to it, no doubt. I do want to go back to this point you make about how Australia did well out of this. Now, you rightly trumpet to how well we might have performed compared to other countries, but the other way of looking at this, Greg, is that when you consider the enormous cost in economic and social terms to this country, the enormous damage to personal liberty, restrictions on travel within the country and in and out of the country, the massive debt we've piled up because of locking down so many businesses for so long, yet our life expectancy during the panic went up rather than backwards in other countries. Doesn't that prove that we overreacted?
Look, there are things that I agreed with and disagreed with. I highlighted in the submission that I was not aware of medical advice for curfews in Victoria or for the 5 kilometre rule, and I believe there was some discussion at the time that there was not a medical basis. And
it was not.
If you had to have medical advice, then those elements would arguably never have occurred, and I think that would have been a good outcome. In terms of Australia's overall combination of actions, borders, testing, tracing, distancing, I know they were difficult. But of all the countries in the world, when you look at both the economic and the health outcome, by May of 2022, we were only one of only 2 OECD countries with a vaccination rate of 98%, a loss of life to COVID of under 300 per million, and an unemployment rate of 4% or lower. So we were intensely focused on that balance of both the economic and the health. And where a country did only one or the other, then you ended up with, I would respectfully submit, some catastrophic human outcomes, whereas we were able to rebound strongly on the economic front. There were no easy choices. There were no easy choices. And if you chose Australia's circumstances versus the agony that Milan, Madrid, New York, and so many others faced, I would say the overwhelming number of Australians would choose the Australian path. However, that doesn't mean it's a blank check for restrictions that do not have the strongest possible medical advice. And that's the important thing. That I want to have a check and balance for and to protect against in coming years and decades and for coming generations.
Well, thanks for talking to us, Greg. I notice a couple of times over the past few months your great friend Josh Frydenberg has refused to rule out a return to politics. I think we'll see Josh back in Parliament sometime. Will you rule it out? You're never going back to Canberra?
No, I'm finished. I was very fortunate. I had more than 2 decades in the service of the Parliament, and it was a great privilege. But I'm now a dad. I'm part academic, part working as the chair of the Mental Health Institute and doing some commercial work. And so I'm very happily in the next phase of my life. I do hope that Josh runs for Parliament, whether it's federal, whether it's state. I think he has more to give. He has unfinished business, and he is an immense talent that would support us, whether it's at federal or at state level.
Thanks for joining us, Greg. I appreciate it. Greg Hunt there, the former Health Minister, putting in a plug there for Josh Frydenberg. I don't think Josh Frydenberg going into state politics and becoming Premier of Victoria is quite the path, is it? I think Josh needs to go back to Canberra.